Assalamualaikum and a very good evening to everyone. My name is Adnan Tasha binti Adnan, and today my group is going to be presenting about our case study. These are all the group members. We have Ayu Dalila, Nur Zulaika, and Sharifah Balkis. So this is the table of contents. This is what we are going to talk about during the presentation. So first of all, we will be talking about the patient background for our case study and the diagnosis, the treatment plan, and lastly, we are going to talk about the discussion. So this is the patient background. So the patient in our case study is a 22 years old woman who comes from an urban background, and she is from a middle class family. She is a second year university student, and she has good academic performance in the past, but has since gradually deteriorated, or it has gradually went down. She does not have a good relationship with her family, and she has also reported to her previous psychiatrist about her chaotic and hostile family environment. And she also has been previously hospitalized for self harm, and she has also took treatment from another psychiatrist. So, um, when her and her mother went to a mental facility, they to treat the patient, uh, they have complained about the patient's repeated self-harming behavior. So she has been known to have been cutting, have been taking sedatives, and she also has tried to hang herself. And she also has aggressive behavior. Um, this is because she has difficulty controlling her anger and her unstable and intense emotions. She also has trouble sleeping. She is unable to sleep at night because she continuously thinks about her past events. So her thinking about it will keep her up at night. She also has been having a lack of interest in all activity, even the activities that she has liked before. She also has been reported to have feelings of emptiness, and all of these incidents has started 2 years ago after she completed her higher secondary certificate HSC exam. So this means that she has been very pressured during her exam until she got into this way. So this is the diagnosis. We have characteristics of it during the interview, and the diagnosis after examination. So during the interview with the clinician, the patient's speech was actually well organized. She was cooperative, coherent. She was kept and cooled. So she is relaxed. She has no psychomotor abnormality. She has persecutory or hostile delusions, but without any suicidal ideations. So this means that her self-harming behavior can come from her wanting attention, because her self-harming behavior, she self-harms after she has a quarrel with her family or friends. So, lastly, we have no perception abnormality, so she doesn't have any abnormality with her awareness. So, after doing her examination, um, the clinician has done history, physical, and mental state examination. For example, they could have done maybe BDI. The patient is diagnosed with borderline with comorbid depression. So, we will move on to the next presenter.
Okay, so Assalamualaikum. My name is Sharfa Balkis and my matrix number is 200330. Okay, for the treatment plan, the patient can be treated using dialectical behavior therapy, where one study found that more than 75% of people with BPD no longer met the diagnostic criteria for the condition after a year of the treatment with the DBT. And the core problem in borderline personality disorder is emotion dysregulation, where the factor is the mixing biologies, emotionally unstable childhood environment, for instance, where the caregiver punish or respond erratically to the child expression or emotion together. So disclaimer for this treatment plan is DBT cannot fully cure BPD, but it can only reduce and manage its symptoms. Next slide. Okay, so what is dialectical behavior therapy, aka thought therapy? Okay, so the form of CBT is focused on the role of cognition, which is it refers to the thoughts and belief, behavior or action in the development and treatment of BPD. So aims of the DBT is to address the symptoms of BPD, where it aims to replace maladaptive behavior with healthier coping skills. So the changes to traditional, as we know that DBT is under CBT itself. So the changes to traditional cognitive behavioral elements of the therapy is these changes are needed to reduce the symptom of BPD. So it could reduce the psychiatric hospitalization, substance use, and suicidal behavior. So next slide. Okay, so focus of the DBT itself, it helps patient to learn and apply skill, and it will decrease emotional dysregulation and unhealthy attempts. And DBT techniques also, it has group skill training where patients are taught behavioral skills by completing homework, assignment, and role playing. New ways of interacting with others. It also have individual psychotherapy where patients learn behavioral skill are adapted to their personal life challenge. And then the last one, phone coaching, where the patient can call the therapist between sessions to receive guidance on coping with difficult situation they are currently in. So I pass to the next presenter.
Okay, thank you, Balkis. My name is Nurslaika Binti Zainuddin. My matrix number is 201119, and I will be presenting the 4 stages of dialectical behavior therapy. So, in the first stage, the patient, they have lost control of their behavior, and typically they feel miserable. Therefore, their behavior it exhibits their emotional distress. So, in the first stage, DBT will help to make the patient move forward by gaining their behavioral control. Next, during stage 2, the patient might be in control of their behavior, but they still continues to suffer in silence. In other words, they still have that emotional distress. Okay, this is due to past trauma and also issues happening currently. So the way the stage 2 will help to get the patient out of their quiet desperation and into an emotionally healthy space, because the counselor will be there. There'll be techniques that will be used to help the client, the patient. Okay, because they will build up their self-respect and also find happiness um, in this stage. Okay, the next stage is stage 3, where patients begin to learn how to live properly. Okay, they finally have control over their behaviors and they are emotionally happy, not distressed anymore. So they can learn how to live a functioning life. So, the main goal of this stage is to live a normal life and be able to cope their life in a very healthy way as compared to how it was before. And finally, in the fourth stage, which is stage 4, this stage is very necessary, is very important for all the patients, because they start to learn how to understand the deeper meanings of spiritual existence. Okay, for example, some people find religion play a big part in their lives, in their thoughts. So spiritual fulfillment can help to meet their life goals. Okay, so this stage they learn to find deeper meaning through a spiritual existence. Okay, next. Okay, so this is the treatment process that we discussed. Our group discussed to give to our client, this client. Okay, so we divided into four, which is from the first session 1 to 3. We will build the client counselor rapport and working alliance. Okay, at this stage, we are actually at the first stage where we try to understand about the patient. We get to know the patient better. We conduct behavioral assessment, and we make sure that the patient understands that the objective of the therapy is to find the effective ways and beneficial ways for the client, for the patient to handle their impulses and their intense negativity. Other than that, they have to find a way to overcome insecurity of their personal identity. So this objective has to be completed before we end the treatment process. Okay, so the next 3 sessions will begin after the counselor has done the behavioral assessment and know about the patient. We will begin the intervention using techniques of DBT. Okay. As here, there is a mix of stage 1 and stage 2. It depends on the progress of the client. Okay. So we will look at group skill training, such as distress tolerance skills, and also emotional regulation skills. Okay, this is because, as we have said before, at this stage they are having struggles with trying to control the behaviors and also emotions. So by learning the skills, they can slowly go to the other stages. Okay, and phone coaching is introduced at this stage, and phone coaching, it will be applied throughout the theory. So the counselor will be prepared for the client, for the patient, if they are in need of sudden reassurances or anything, they can just call the counselor. Okay, so the other sessions is continuation of intervention using techniques and also techniques to improve the patient's condition. Okay, so in this stage, we are more focusing on the stages 3 and 4 of DBT. In this stage, the patient is more stable. They begin to understand about their themselves. They are more control of their lives. Okay, so in group skills training, we will focus on the core mindfulness skill and also interpersonal effectiveness skill. So here, they would begin focusing on their relationships with other people, as well as mindfulness, as in how to control their thoughts, not controlling their thoughts, as in like thinking about what others think of them, more towards how they can help themselves. Okay, so, and again, phone coaching is continued until the final therapy session. And the sessions will depend on how the progress of the patient, and it usually GBT will usually last for until 6 months. Okay, finally is the closing of working alliance. At this stage, the client is more stable and is able to function as a person. Okay, and has improved in a lot of aspects. Okay, so the counselor can finally close the sessions, close the treatment by evaluating the patient's improvement from beginning of the first session until the end, and also the patient can reflect on the uh, experience on controlling their behavior and their hopes for their future. Okay, this is because the counselor is not going to be with them after this, and they have to start living by themselves. Okay, finally, if there is no other problems and the objective has been reached, the working alliance can finally be terminated. Okay, next slide. Okay, the outcome of the treatment that we can see from GBT, the client is more organized and has more regulated thoughts. They have the lesser tendency of doing self harm towards themselves and a lower feeling of insecurity. They are more confident. They have higher self esteem. They do not really need to rely on others much, and also improve relationships in terms of, as we have seen before, as during the The first part, the client has issues with her mother, and after this treatment, she can have a better relationship with her mother. Other than that, she has an improved quality of life, and finally, increase of the use of behavioral skills. Okay, that is all from me. I will pass to the next presenter. Thank you.
Okay, hi, my name is Ayu Dalila binti Shabri. My matrix number is 202636. Okay, I will continue on discussion part. Okay, so discussion we discuss about the borderline personality disorder, where the borderline personality disorder, or known as BPD, is a personality disorder that classified or under cluster B. So what is cluster B? The cluster B personality disorder is characterized by dramatic, overly emotional, or unpredictable thinking or behavior. So people with BPD, they will have extreme mood swings, unstable relationship, and have trouble to control their emotions. So based on the studies, nearly 75% of people diagnosed with BPD are women. So BPD, or borderline personality disorder, can be described as a chronic pattern of interpersonal connection instability, self-image and affect, and notable impulsivity that begins in early adulthood and manifests itself in a range of circumstances. So next I will speak about the symptoms. Okay, so there must be at least 5 symptoms or more. Okay, so the first symptom is affective instability as a result of mood reactivity, which means they are having unstable emotions. Next is inappropriate intense anger or difficulty controlling anger, which means they have difficulty to we call to control their mood swings. The third is chronic feelings of emptiness, which it means that you lose interest in many things. Which means like if you love to do something, but right now you already lose interest to do that thing. The third is regular basis or always suicidal behavior, gestures, or threats or self-mutilating behavior, which it means that uh you always think to attempt suicide, and sometimes you are also hurting yourself, like cutting yourself. So that's about the suicidal behavior. Next is identity disturbance, persistently unstable self-image or sense of self. And the lastly is transient stress-related paranoid addiction or several dissociative symptoms. Next. So as we can see that the patient with BPD, they doesn't have a constant high mood. Instead, they have a pattern of fast mood shift, or we call it mood swings, in response to environmental events, or we call as factors, with high periods lasting hours rather than days or weeks. Next. So this is the three main causes of this personality disorder or borderline personality disorder. The first cause is genetics. So people who have a close member with BPD may be at higher risk of acquiring the disorder. Which it means if you have a family history who diagnosed with this personality disorder, so you have a high risk to also diagnosed with this personality disorder. And the second causes is environmental factors. So this is the four example of environmental factor, with it, you being a patient being a victim of emotional, physical, or sexual abuse, being exposed to long-term fear, being neglected by parents since their childhood, or growing up with another family member who had a serious mental health conditions, which it means that you growing up with a family that use drug abuse or alcohol abuse. So this environmental factor really can make you to diagnose with borderline personality disorder. And the third is brain function. So people with BPD have something wrong with their neurotransmitter in their brain, particularly serotonin. So this serotonin imbalance have been linked to depression, aggression, and inability to control destructive impulses. Okay, next. So what we can say again, that the managing patient with BPD, as you can see, is a burdensome for clinician or doctor or psychologist because they may have to deal with repeated suicide treats and attempts over years. The study found that the patient can be treated using dialectical behavior therapy, DBT, but this therapy will not fully treat the patient, but it will just reduce the symptom. So some clinicians they suggest to use the drug treatment to the patient, but in 2009, the National Institute for Health and Clinical Excellence, or known as NICE, indicated that drug treatment for BPD should not use frequently. This is because the drug treatment they may consider for comorbid illness and short-term sedative medication may be considered for those with BPD in a crisis, which it means the drug treatment is not really effective lah for people who diagnosed with this treatment, with this personality disorder. Okay, next. So this is the implication of the borderline personality disorder, where whereas if patient diagnosed with the personality disorder, they can negatively affect their intimate or interpersonal relationship, their jobs, school, social activities, and their own self-image. The firstly, they will face the job loss or changes on a constant basis, because it means they always have difficulty to be accepted in a job promotion, or they always have to change the job setting, or recall the job the workplace. Secondly, they will face conflict-filled relationship, marital stress, or divorce, which it means they will have a not really good relationship with their family member or their spouse or their children. The third, not finishing a course of study, which it means they will having a difficulty to study, to continue their study, or to, we say, finish their study. The fourth, they will do self-injury such as cutting or burning and frequent hospitalizations. And the fifth, they will affect their life by attempted or completed suicide. Next. So the borderline personality disorder, they can also affect someone by having other mental health disorders such as depression, bipolar disorder, anxiety disorder, and alcohol or other substance uses. Next. So in conclusion, what we can say is that dialectical behavior therapy is the most suitable therapy for treating a patient with borderline personality disorder. Group and family intervention are also encouraged to be used as treatment when necessary. If this personality disorder is not treated quickly, the patient will suffer from more severe symptoms of borderline personality disorder. Next. Thank you. That's all for us. Thank you very much.